Hi, I'm Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show.
Welcome back to Health Futures, and today is no different. We have a special show here today. I've got a repeat guest. She hasn't been here on the show for over 10 years, and I've got right across from me Alyssa Crockett. She's a Senior Vice President of Philanthropy for InherisAI. Welcome back to Health Futures.
Thank you. And thank you for sharing with me earlier that I brought my son 10 years ago.
I know, right?
What a patient, generous guy you are, Bob.
Well, thank you. Thank you very much. And it's so great to have you back. And to your, it would be your right or your left, and to my right is Miles Kramer. And Miles Kramer, he is the president of behavioral health for InherisAI. Welcome to Health Futures.
Thank you very much for having us and for everything that you do to increase awareness about senior health and particularly senior mental health, which is, I think, what we're here to talk about today.
100%. And across from you and to my right, I've got Ron Van Horssen. He's the founder and CEO. Welcome to Health Futures.
Thanks, Bob. Thank you so much for having us. This is wonderful.
It's great. And now that I have you as our CEO here and our founder, I would love for you to talk to us a little bit about InherisAI and how it came to be.
Well, I'm happy to do that. And we think it's a message that's so important to get out to seniors and really across the board. My exposure to it, to what became the concept and I really came from my experience with my partner who had at the time, he was a 14-year-old son. And she was helping him deal with significant issues related to psychological and emotional abuse from his biological father. And despite court orders to get care and to find care, I watched just how hard it was for her to find the right therapist to deal with such a crushing problem for an adolescent. And that has continued. But what I saw as I watched her deal with this was how broken the behavioral health market is. And I've spent a better part of my career in and out of healthcare and at senior levels, involving new technology and also advanced services. But behavioral health just has some major problems. And so in looking at what caused that, fundamentally, you pull back and you say, there's not enough money going in. There just isn't. Government's not going to fix the problem. They've never been able to. And insurance companies don't either. They struggle with covering behavioral health care. So the concept that came out was the time is now to apply artificial intelligence to open up a whole new way of paying for health care, which is tapping into the philanthropic wellspring, really, that exists in America. And that's what we're doing.
That's the beginning. So what's interesting for me is if you could give me a timeline for you, because first of all, Ron, I give you such great credit. I mean, you see a problem and you're trying to figure out how to solve for it. The government's not going to do it. So you're like, okay, how do we solve for this? And my partner went through this, and he should have never gone through what they went through.
Yeah.
So from a timing standpoint, was this before the pandemic? Was this in the 1990s? When did this?
This started late last spring.
So this is new.
This is very new.
Wow.
And we've been able to make the progress that we have because of the advances in artificial intelligence.
Okay.
I've been building businesses and advising for decades. And what now we can do with AI is just amazing. And that's helped us in the business planning. It's helped me in finding Alyssa, finding Miles, and bringing them on board has really amazing team to build this out. So it started late spring, early summer. Miles came on board in the fall, Alyssa just before the end of the year, and we're building a substantial national company around this.
So I'm just meeting you now, and I don't know a whole lot about your background. And I think all of us, and certainly my listeners and viewers, want to know that too. You sound like you're like one of these serial entrepreneurs. Tell me about your background and what.
Yeah, I kind of get characterized that way.
Yeah, I mean,
So-
look, to me, I mean, you went from ideation to warp speed overnight. So I really would love to know a little bit about your background and how you were able to do this.
Well, I back in the mid '80s, I founded the first company to provide mobile MRI services to hospitals.
Wow.
And we built that into the leading national company in shared diagnostic and therapeutic services. So that was, for 4 consecutive years, we were on the Inc. 500 list of fastest growing companies. So, and I got some recognition for that. And since that time, I've built a number of other companies, also served as advisors on
But the
boards.
mobile MRI, back in the 80s,
Yeah.
those things weren't cheap.
No.
And you put that on wheels and moved it around. I give you lots of credit for that.
We did more MRI scans while we were growing than anyone else in the world, literally.
Incredible.
So.
Incredible. Well, Ron, it's great to have you here in the studio with me.
Bob, thank you again. This is a wonderful opportunity. It's sorely needed. Behavioral health is such a tough but so needed across the age groups.
Yeah.
So and it's particularly good that you're focusing on the aged side. When I started looking at this, my focus initially was on how cruel it is for the youth.
Right.
And so initially it was like, this is crippling our next generation. And so we certainly look to that as well, but we also are well aware, and Miles can speak to this very effectively, of the need for behavioral health among the aging population. It's just going to get more critical.
We all know behavioral health is something that was really not talked about in the past. You would go to family gatherings and people would say, Uncle Chaz, you want to stay away from him, or, Aunt Edith, you don't want to really get too close to her. Or there were whispers, and now, people are opening up. What's it, 1 in 5? 1 in 4? 1 in 5.
1 in 5.
1 in 5.
Yeah.
And it is a challenge across all ages, as you've indicated. But I'm here also to share that the state that we reside in is doing a really poor job of taking care of our behavioral health challenged members or citizens. And it's constantly they're cutting the budget. And we know, because some of us support not-for-profits that are getting maybe a third less in dollars, and I won't mention names, than they have in the past, and they've had to lay off all these people who were doing the good work.
Yeah.
So, one of the things I hear you saying, Ron, is that, the federal government, state government's not there. We have to solve for this problem.
Yeah.
And right now, Philanthropy, and I'm sure you're probably looking at grants too from foundations and stuff to make this thing work. So here we are with InherisAI, and you've assembled a team, and I've only got part of it. I'm sure there's a bigger team here. But I got the president right here of behavioral health, Miles Kramer. So would love to hear a little bit about your background and how Ron and you got connected, and really what you're doing now in the mission going forward to be a resource and a place that people can come to be able to get therapy or whatever it is that they're seeking and treatment.
Yeah, absolutely. And thanks for that. I'm a licensed clinical social worker, so I've been a behavioral health clinician for my entire professional career. And my career is kind of divided half into safety net and public community mental health type work, where we were always budget constrained and had a wealth of people who needed help. and not enough funds to do what we really needed to do. And I probably spent the second half of my career in what we would lovingly refer to as investor-owned healthcare, so working for a couple of very large owner-operators who provided acute behavioral health services and other types of care, usually had senior behavioral health programs or tracks, and was involved for a number of years in building and operating new senior behavioral health programs. So that it's a service that's very near and dear to my heart. But throughout my career, what's been very apparent is not a shortage of great ideas or really compassionate people, but kind of a fits and starts of funding. Something gets started, it's a great idea, it shows great results, the funding runs out, we shut it down. So from the very basic level of the work that I've done, it's always been clear that the cash for care was just not there.
Right.
And the people that are trying to deliver the care spend in many ways more time trying to figure out how to keep the lights on and the doors open than they do how to provide the very best care that they can.
That is so true. I mean, I see so many people with great ideations and get these startups, and more than half their time is spent trying to raise money and not really concentrating on what they're building. And, I see that. And I wish, to be honest with you, I wish there was a repository somewhere where all these companies failed, where people who may have the same ideation could access to see what they did good and what they didn't do good, so that they could learn. So they maybe someday with storage and AI and the way it is, maybe we'll be able to capture some of that data. But very interesting. So I would love to know how the two of you guys got connected and how that happened. I'm guessing, it wasn't a job posting, but it was probably through connections.
Yeah, I was very fortunate that Ron reached out to me, and what was so resonant about this opportunity and joining this team was the focus on actually doing something that hadn't been done before. Being able to put care directly into the hands, or put funds directly into the hands of people who need care, is not something that we could have done before the type of AI technology that we have now. And being able to kind of rethink the core problem, which is if you can afford care, if you can put that money out, then there is care available. And so when Ron reached out to me, I thought, as I think some of the people we continue to speak with think, that we were going to build an AI that would provide some semblance of therapy and would in some ways replace therapists. And we're doing nothing even remotely close to that. What we're doing is helping people get access to human care of their choice with funds that they otherwise would not have available. So we aren't turning ChatGPT into your therapist or creating another synthetic relationship that can do some not very positive things sometimes, but reinforcing human connectivity. And beyond the ability just to fund care through philanthropy for people who need it, we are creating a connectivity and a community between the donors who will be supporting that care, the people who benefit from their philanthropy to receive that care, and creating a reinforcement for the network of providers that do the great work that they do, but more and more often are shying away from insurance programs because of the administrative work that it takes just to get paid for the work that they do. We see 35% of behavioral health providers in the country today are cash-only providers. If I were to say that to you about cancer doctors or pulmonologists or any other specialty, you'd fall out of your chair. But part of the reason you don't is because we're used to hearing kind of absurd things about behavioral health and why and where it doesn't work. That's just kind of the latest example.
It warms my heart. And I went into this visit here on the podcast today not knowing a whole lot about InherisAI. I've got some notes that I'm going to refer to. But, the thing that I realize more than anything today is that we're all drinking from this fire hose, and we're learning at such a rapid rate. Generative AI has been out and unleashed for probably about 3 years. I was one of the early adopters to it. And your point, there are a lot of people that are using AI agents to do therapeutic work and, talking to humans, and it's not the same. The world has become more transactional in nature, and everybody's looking for transactions. And I talk about this a lot here on the podcast, and I talk a lot about from the podium, is that we're humans. We need to be relational. We need to be with other humans. We need that care and compassion. We need somebody that really knows us. Robots and AI agents don't. So it warms my heart that Alyssa said, you got to meet these guys, that we're here talking about something that I believe in, and I truly think that we can never, ever lose sight that humans need to be the point of contact with another human being. AI can help us. It can do a lot of the stuff on the back end. It can do a lot of repetitive and redundant tasks that humans do. But relational is what we need to be.
Yeah.
So go ahead.
One of the things that I think we're all most proud of in the way we're bringing this into the world is that the part of the work that AI will do is really the part that only AI could do. And that is speed. Most of what's happening in the world as far as philanthropy is incredible and generous and any other positive you'd like to describe it with. It's not fast and it's not responsive to immediate and individual needs. So if you were to think about how many people we would need to hire to process what we anticipate to be hundreds of thousands or ultimately millions of requests for help in funding care, and the same number of people saying, I'd like to help, behavioral health is important to me, we would need thousands and thousands of people sitting by phones ready to take those calls. So the AI can do that very, very efficiently, and that efficiency allows us to do something we don't think has ever been done before, and that is that 100% of the funds that come into our nonprofit fund will be used to fund care. There is literally zero overhead in our nonprofit, and we use the term pure philanthropy to describe that.
Wow. That is really awesome. Go ahead.
I was going to say, what Miles is talking about is a hybrid corporate strategy, which is really a key part of what enables us to do what we're doing. So that was a starter for me, is that philanthropy really should go to help. And particularly in this case, where unlike philanthropy, where you're trying to build a new building or something like that, we look at behavioral health care, and a core part of the solution has to be paying for care. It just has to go to the people to pay for care. So we want 100% of everything that comes in to go out to pay for care, and it does that.
And I'm making the assumption, but I'm pretty sure you're 501c3.
It's a 501c3 that we have as the Inheris Mental Health Fund, and then we have a venture-backed operating company, which is InherisAI, and that's where we take in traditional venture capital and accredited investors.
But I mean, when people are making donations, they look at the 990s, right? And they want to know where the money's going. Yeah. And I am a benefactor to many not-for-profits, and I serve as vice chair right now for All Thrive 365. Yeah. And I know donors, especially sophisticated donors, are looking at those 990s and they want to know where the money's going. So it pleases me to hear that future donors are going to be looking at your 990s and see 100%.
That's it. That was a requirement for me. I've been on that side of
that is table. Really awesome. So in the spirit of philanthropy, you found this young lady who I've known for a little while now. We said 10 years. I probably knew her maybe 11 or 12. And I was glad to have met her because I knew her before then, because people had told me, do you know Alyssa Crockett? How did you find Alyssa Crockett? And Alyssa, I want to know how you gravitated to them and how you said, I'm all in. So please, if you would, indulge us. We'll let you take the mic and tell us how you guys got connected.
Sure. So as you know, when I moved back to Phoenix in 2010, I started at Hospice of the Valley. And I've been in healthcare really ever since. And I had some great experience working with Valleywise Health Foundation and really seeing
I remember you over
public health and the state of behavioral health at many different levels. And then most recently, I was at Banner MD Anderson Cancer Center and leading philanthropy for the Cancer Center. And it was a mutual acquaintance of mine and a good friend of Ron's, and a business partner of Ron's, who had heard me speak about an effort we were doing with throat cancer and developing a translational research lab downtown. And so Phil Neary, thank you, connected me to Ron, who said, I have this friend who is doing something in philanthropy and AI. And I thought, well, that's pretty cool. I've always been interested in that and how we can really harness AI to do more good and do it better. And so when Ron and I first met for breakfast, he laid out his vision, and I got the mental health piece right away.
Oh, I bet you did.
But the philanthropy piece really excited me too, because this represents a total transformation in philanthropy and how the donors experience philanthropy, how the philanthropic impact is experienced by the people receiving it. And we can do all of this at scale. None of this has been, as Ron said, it hasn't been possible before, but we can use AI to accomplish great things and at the same time provide a level of human connectivity that is missing in philanthropy many times.
100%. I mean, look, you worked for Banner. Mm-hmm. You worked with other not-for-profits like Hospice of the Valley. You know, the biggest challenge that we have today, and being a benefactor to some of these, you know, we talked earlier before the show started about Duet. Mm-hmm. The Alzheimer's Association, the people that they hire today, unfortunately, that work in these roles, they're newly out of school, they're much younger, and I'm not here to knock generations, but they don't understand this. They understand how to sit behind a keyboard. They don't understand relationships, and they don't understand the encounters. So go out to have a coffee with somebody and talk to them about what really what does behavioral health really mean to them, or whatever the cause is really means to them, and really get a chance to meet the person. So I applaud you for doing what you're doing to at least find your donor base, as well as to drive the InherisAI. You're using a lot of AI to do that too. And
Absolutely.
And I'm experiencing it with my own home care company, where we have so much machines doing the work behind the scenes that makes us so much more efficient. So I know in the old days, charting was a very laborious process. And I can tell you that my care managers would be up to 11 o'clock at night keying and writing things in. And now we can do a lot of transcriptions. We can really, score and summarize and do a lot of things utilizing AI in the back end. I imagine that's what you guys are doing.
Yeah, those are terrific tools that have helped a lot with clinician efficiency.
Right.
And ideally, those tools let us as clinicians spend more time putting hands on patients and less times putting hands on paper or keyboards, as the case may be. Less pajama time for providers, which is the time that everybody spends after work for free doing all the paperwork that's required of them. And so those are kind of tools that are based on the principle of let's let AI do all the jobs that are not good for people to do, that we can let them focus on other things. And so that's certainly part of what we're doing. It's not just the efficiency, but it's the ability to let the AI be awake 24 hours a day, to engage with people, to keep in touch with people, and then ultimately to facilitate that connectivity and hopefully reduce that isolation between the people who are receiving the awards and needing care and the people who are often used to donating to a nonprofit and sort of hoping that those funds go to benefit the people that they care most about. One of the things that will be very unique is the ability for donors to really curate or specifically reflect the impact that they want with their contributions. This is a population that I care most about. I've had this issue in my family. I want to help families that are facing the same type of issue. And that we think is very novel, that a donor can specifically say, help these kinds of folks with my gift.
Impact. I like that. So, Miles, can you take us through a scenario, if somebody reaches out to InherisAI, and how does that look like? I mean, if you could kind of paint this picture for me and our listeners and viewers here today.
Well, bringing it back to senior mental health, I mean, one of the things folks don't often understand about seniors, this is how you kind of started, they often have coverage. They have Medicare or they have Medicare Advantage. And in the state of Arizona, it's about 50-50. So they have coverage. Coverage isn't access. And so when people need behavioral health care, if they have traditional Medicare, they are probably set up to go to a health system, and that health system likely has services that are available. They may have a senior track, but they definitely will have a copay or share of cost. Kind of on the worst side of that equation is the Medicare Advantage recipients who have these very curated narrow networks, and you must go to that network provider, and then you still have a share of cost or a copay. So seniors particularly are already generally getting a lot of health care. They may be on some expensive medications. They may see a variety of specialists and their primary care doctor. All of those visits have copays. They're generally also on fixed incomes. So getting access to behavioral health is often going to be curtailed by what benefits they have, who's in network, and can they pay the share of cost or copay for that care. So that kind of person who might want to access behavioral health services could apply for an Inheris Award, would receive the philanthropic grant directly in their hand through the form of a digital payment card, and could then use those funds to pay for care wherever they choose, irregardless of their network. So that could pay for their copays. That could pay for a cash pay provider, because 35% of providers are out of the insurance world and take cash only. It gives them back their choice, and it gives them back the ability to access care that they otherwise would potentially be barriered from just because of the fact that they have coverage.
You know, it's interesting, and I'm a little bit on the old-timer side. So if you wouldn't mind, what's a digital card? How do we do this? Because and you know, I'm thinking about my seniors too that might need this help. You know, how do we charge that card and give them money and access to that?
Yeah, so it sounds more complicated than it is. I think seniors have probably their Safeway card on their digital wallet and their Apple Wallet or their Google Wallet. They may have a Starbucks card that they use to buy coffee. And so it will be just that complicated. They will apply on a process that's very easy. We will push until that process is 5 minutes or less to say, I need help and I need help paying for that care. They will receive that card in their Apple Wallet or their Google Wallet. And they'll have the ability then to go to essentially any provider and use those funds just like cash. They couldn't use it for anything else, just like if you had $1 million on your Starbucks card, you still couldn't buy a ticket to an airplane ticket with it. You can only get a lot of coffee. So our providers are really the only folks who can receive those funds. So providers participate with us. They get paid just the same as if somebody had the funds to pay for their care and walked in with a platinum card, but they're using philanthropic dollars, and those can pay the full cash rate. They can pay their copay, which they otherwise couldn't pay. And all of that gets handled. The movement of money, the approvals, the interaction with the provider, all gets handled by the AI. So it's at that kind of light speed. There isn't the delays that you would normally see.
Fascinating. And I'm really glad to have you guys here on the show today. And I know that this is something that was cooked really quickly and coming to market. How do we get the word out? I mean, we're talking here today on the podcast, but InherisAI, I mean, how do we have people aware? Because for me, you took me through the process, but you know, if I'm a member of the community and I've got a son or I've got a parent that is struggling, you know, how do they find you, and what's that process look like to be able to be eligible for to be a member or be eligible for a grant through InherisAI?
Yeah, that's great questions. So we are evolving and coming to market very quickly, as you said. And we are beginning a pilot project with 5 clinics that have said, hey, we'll participate. We'll help you work through. One of the things that you really have to be sure of before you tell an AI, go off and do this on an automatic basis, is that you have tested your processes and you know they work. Our processes sound complicated, but they're really not that complicated. We're just talking about people moving cash from one place to another, from a philanthropic fund into a provider's account so that they can get paid for delivering the care that they deliver. Who will be eligible for these awards is also evolving. And I think one of the things we're very committed to is the belief that a lot of people don't get behavioral health care because of the stigma around it. So a lot of people, 60% of people with a diagnosed condition never get any care. That gets worse when we talk about seniors. That's 70%.
So that's 1 in 5, 60% of them don't even get the care.
Right.
1 in 5.
Right.
So if you could imagine, again, saying that about cardiology or cancer, somebody has these illnesses and just never got any care at all, it would be astounding. But it's another one of those times where we go, yeah, well, behavioral health it's kind of different that way. So folks will be able to apply directly through the AI portal for them. It will ultimately move to a phone-based app that will be designed for ease of use. And we're going to really grind hard on that to make sure that what we hear from people is it's very easy to use. It's senior friendly. It's everybody friendly. It'll be in multiple languages. That's something else that an AI can let us do. And our belief is kind of twofold. One is if you're climbing over the stigma to say, I need behavioral health care, and saying, I need help to pay for it. If you're saying those two things, that's a pretty substantial gating item. So we will have some criteria around income and ability to pay for care. But what we're not interested in doing is really digging deep into everybody's situation and getting a pile of documents and saying, well, you make a little bit too much and you make a little bit too little. There are rules we have to follow, but our ultimate goal is to make it as accessible as possible. And so we've set up some criteria that will provide an early screening and kind of a first tier look. And then we've really thought about a number of fast tracks where if people have very substantial situations that are impacting their life and their need for care, that they sort of move quickly to the front of the line, and those qualifying events or circumstances give them that ability to get care quickly without a huge kind of deep dive into their finances.
So obviously there's a lot of fear with AI. And, when you put AI and combine that with behavioral health, like you said, there's a stigma. How do I know my personal health information is not going to get leaked out there and someone else to find out about what I'm dealing with? Because that's my matters, and that's the stuff that will really, really bother me.
Yeah. That's a wonderful question, and it's a concern that we've had from day one. In fact, the partner that we've selected to actually build the critter that will be running all of this, do the coding and build the device, a cloud code thing, social worker, not the technical guy, but the folks that will build that, part of why we selected them was because of their focus on security. But more importantly, we won't be getting into people's private health information or protected health information. We're not a provider group. We're not a group of clinicians. We're not a group of doctors. We are essentially a funding mechanism for behavioral health care. So if I see a therapist and I use a credit card to pay for them, Visa doesn't ever call that therapist and go, hey, send the notes over. We want to see if this care was justified.
Right.
The money just moves, and that's very much the way we will work. As far as when we screen people or ask people, hey, why do you think you need behavioral health care? That's going to feel much more like a conversation with a friend and a lot less like a conversation with a therapist. You might say to your friend, yeah, I get depressed sometime. I see a therapist. They really help me through it. You're probably not going to get into the level of detail that you would with your therapist about what goes through your head when you're feeling depressed and the nature of that isolation and hopelessness. You'll keep that at a very different level. And so friendly interaction with the AI, clinical interaction with the human professional delivering your care.
I look at you guys as really the conduit, right? You're the one that can take.
Good word.
You take the people that are suffering in our communities and bring them to the behavioral health specialist to be able to help them and give them the funding to be able to do that.
Yeah, and from the beginning, we've positioned ourselves as clinically agnostic. We believe that people can make the best decision about what kind of care they need, what specific provider they want to go to, rather than having to be directed to, through narrow networks coming from the insurance side or Medicare Advantage. So we really believe that that's a key part of what has to work and what has to happen in behavioral health care, because you have so many providers that have opted out of participating with Medicare, with Medicaid, and with the insurance companies. They just won't deal with the hassles.
Right. I get that.
Yeah. And you can make an argument that some of the likely best providers are in that category.
Right.
They just want to focus on patient care.
I know people in our community that have left that market and
absolutely
gone to the private pay side.
Yeah, and that's
100%.
and that's a trend. That's a trend. So, and we look at it and we say, look, there's no one I've talked to about this from the very beginning that doesn't have a first-person experience.
Right.
Everybody.
Well, 1 in 5. I mean, we all are affected either directly or indirectly.
Yeah. It's what we refer to as the ripple effect of behavioral health in mental illness. And it's larger in mental illness, arguably, than anything outside of COVID. I mean, because it just covers the whole society. So if we can help address that,
So would you give an award, because there are people now doing it via telehealth? And, can you
Absolutely.
be a recipient for
Absolutely.
telehealth? It doesn't have to be an in-person
absolutely,
encounter.
and Miles was an early innovator
Yep.
in telehealth. Yeah.
Yeah, telehealth is very effective, and strangely enough, when they do patient experience surveys, seniors report greater satisfaction with a telehealth encounter than an in-person encounter. And that's not hard to figure out. They didn't have to drive, they didn't have to wait, they didn't have to be exposed to sick people in a waiting room. If they have the technological fluency to do that, and many of them do, they FaceTime their kids and they spend a lot of time interacting with devices. There's some upsides and downsides to that. But again, we feel like people should be able to get the care that they want in the way that they want and not be curtailed by some rule that is in many ways designed to restrict access, to maintain insurance company margins, or to maintain control of their narrow network.
Go ahead.
I was going to say, one of the things that doesn't immediately come to mind, because we're talking about behavioral health so much as a key, and that's the need. But what's amazing is the degree to which we think this is really going to transform philanthropy. Because we're putting in an engine that can take and promise to donors this pure philanthropy. Every dollar in is a dollar out for a specific care. And we're starting with behavioral health care, but as Alyssa and I have talked about, there are other areas: cancer,
Right.
cancer therapy, rare disease treatment, where the gap between ability to pay and the need for care is huge.
It's widening too.
It is.
It's totally widening.
It is. And so, and this is I think what really kind of resonated with Alyssa when we first started to talk, because it became clear to me that her interest in philanthropy, with the long background that she has, is this is a sector that needs to change. And so we really are driving transformative change in philanthropy. It's a huge thing, and she saw it right away.
Right. And again, you're talking about other verticals that you can go to. Mm-hmm. Is Inheris specific to the behavioral health? Or are you going to create it in something else?
No, that's our hybrid structure.
Okay.
So we have the venture-backed company that is a for-profit company that is a platform.
And they're not looking like for like a 3 to 5 year exit.
No, we're building a transformative company.
I love that.
Yeah.
I love that,
No,
because I'm used to hearing people do deals with private equity, but you're dealing with a venture fund. And
I've lived that life too.
Yeah.
Our goal just in behavioral health is, in our 4th year, we'll be distributing $5 billion in awards.
Wow.
Yeah, that's
I have
2 million
chills.
people.
Yeah.
I have chills.
Yeah.
And that's only scratching the surface too. So that's
Yes.
the scary part, but still, that's progress.
It is.
And what's interesting, I was holding a tab down in my mind when you're talking about the telehealth piece. The coolest thing about the telehealth visits is that, one, and I know this because I've had doctors on my program before, is that it's more than the 7 minutes you get in the exam room. That's number one. And you said, you're right. It's, you don't have to get in the car. You don't have to wait in the exam room. Or the waiting room and then the exam room. But you actually get to see where they live. And I've had doctors tell me they show the cat, they show them the dog, here are my kids. You get to see how they live. And that's really important. It makes that connection so much better. So I'm an advocate of telehealth. So I'm really glad that that is one of the places that you will be able to award a recipient, and they can use it for telehealth.
Literally, we want every qualified provider of behavioral health care to be able to accept an InherisAI. It's just like it's like an HSA card or a credit card.
I like that. There you go. It's like an HSA card. So, Alyssa, you are obviously drawn into this philanthropy beast that has been created, which is, I say it in a very positive way, because it is going to transform the way we deliver care, because we're going to give access to we're going to give them access to capital to be able to pay for their treatments or their visits and all those things. Tell me what this has meant to you, because you've had a long career in the not-for-profit sector, and you just came from a really big organization, Banner, which happens to be the largest employer in our state, and they employ about 60,000 people. Here you are in a startup, but with a huge mission. And I'd love to get your take and feelings about where you are today and where you see, reaching, 2 million people.
Yeah. So I see AI being, and companies like Banner are at the forefront of that. They're harnessing AI within the healthcare setting in some very innovative ways, which I saw Philanthropy help fund at the Cancer Center when I was there too. But where the industry that AI hasn't really disrupted yet is philanthropy. It's a pretty traditional industry, and it's been operating the same way for a long time, at least since I've been in for almost 30 years. And it's ripe for innovation. It's looking for ways to address what we've called internally the overhead problem, which means people and marketing and all the things that you've traditionally needed to do the work. And in our case, our business model provides a nice alternative to that.
It does.
The market recognizes the value of the people and the IP, and yet the funds are really protected and the donor intent is honored 100%. So I think that's neat. It also harnesses a couple of different trends that we're seeing now in giving. One is direct giving. So you saw that with the Michael and Susan Dell gift. That's going to put money directly into accounts for youth. And then I locally, there's Mother's Grace, which does some great work too, with direct giving to mothers who need some help to get through crisis. And then this idea of collective giving. So how can we use donations that might come in from across the country to help one person here? Or how can somebody's $25 donation impact 25 people and allow them to access mental health? So I think we're going to see, as donors are getting into InherisAI, this empowerment that they haven't been able to feel before at a very different level, that's going to open the gates to additional giving. I think Americans are the most generous in the world with their philanthropy.
They are.
And they've only been allowed to give certain ways. So our model really allows them to give in multiple different ways. They can see their gift having impact in real time with real people. And the transparency is there. They're getting things they haven't been able to get before at a speed they haven't been able to hear about before.
Right. And these organizations that you've worked with, obviously, and I am new to this, so I may be asking some questions that may be a little out there in left field, but donor advice funds are established in these not-for-profits. There are certain criteria that people have. Matching gifts, very generous people say, hey, I'll give $5 million, but you got to raise $5 million. Outreach. I mean, you are a very pivotal part of Inheris. I mean, without the philanthropy, it doesn't work.
Correct.
So, I not to put you on the spot,
I know.
just did, but it doesn't work. And,
Right.
and I know that you might be building a plane a little bit as you're flying it, but what is that message? How do, can donors do donor advice funds? Can they do challenge gifts? What does this look like for donors? And attracting them into the Inheris web to really understand that this is a philanthropy, not-for-profit, and every single dollar goes to really good stuff for people that are challenged with behavioral health issues.
Yeah, so in the first couple of months, we're meeting with major donors, community foundations, hospital foundations, looking for those larger investments to help get the pilot miles described up and running.
Right.
Donor advised funds is an interesting segment of philanthropy. They're sitting on a lot of latent capital there. And so we're hoping that we're attractive to those types of donors, family offices as well.
Absolutely,
could have
family
huge
offices.
impact
Yeah.
to what we're doing. So in the beginning, I think we're looking at those folks who have a mindset that they want to, they're interested in systems change and transformation, problem solving, until we get into a more public-facing space with a website and the app, and where we can really communicate with people via social media and other.
You know, it's interesting. We talked about it off the air, and you just brought up the problem. You know, we got to find a big, hairy problem to solve, and this is a really big one. And the fact is that 1 in 5 are affected. These are reasons why I see you guys being really successful, because everybody's been affected by this, either directly or indirectly. And when you can share with them that the crisis that is out there, I think the data point that you shared, Ron, was, or maybe it was you, Miles, that 30% of the people that, you know, they can't pay, or what was that stat that you gave?
So 60% of people that have a diagnosable mental health condition never get any care at all.
They never get care at all.
70% with older adults.
70%. Wow.
Yeah.
And
It's unacceptable.
It's staggering.
And we know that the financial reason behind that is significant.
Yeah.
It is very significant.
Wow.
Coverage does not equal access.
No, it does not. So I'm going to ask some rapid fire questions. I want to put you guys on the spot. And then I want to close too. And I want to close to see if you have any questions that I've not asked that you would like me to ask, or just each one of you leave some lasting thoughts, not only just for me, but our listeners and our viewers here today.
Great, Bob.
All right. So I'll start with you. What's one word that describes InherisAI?
Good.
Biggest myth about behavioral health?
That it's simply sitting on a couch talking about your feelings. There's much, much more to it.
Prevention or intervention?
Prevention.
Data or empathy?
Empathy.
What's one innovation that excites you right now?
The speed, being able to get care into people's hands immediately.
A leadership trait that matters most in the field that you're in?
Focusing on good.
All right. A book or thinker who inspires you?
Wow. A single book. I think for all of us in the therapy world, Dr. Irving Yalom is one of those people that taught us all what treatment and what therapy means and how to understand it in very simple terms.
Right. Alyssa, what keeps you optimistic?
People do.
I agree.
I love
100%.
people.
I do.
I have faith in us.
Our country is made of people.
Yeah.
We come in all different sizes, have different ideologies, but people make it happen. All right, so my last question is to Ron. 5 years from now, what does success look like for you?
A platform that is truly a fundamental part of philanthropy, that's channeling funds on a 100% pure basis across a number of sectors. We'll be known for what we did in behavioral health care, but that is a starting point for us.
Oh, I love it. Absolutely love it. All right, so before I teed up the rapid fire questions, I wanted to see, is there a question I haven't asked that you would like me to ask while we get ready to wrap up our show here today?
I don't have any. I don't think so.
Okay, so I'll leave it to Miles if you would like to. Lasting thought that you would like to leave our listeners as we get ready to close, and leave also a way for us to find out more about InherisAI.
Well, maybe I'll start with the end. We're at that point where we're going from quiet to soon get very loud, and we will be getting very loud shortly. So ask when you see us on social, when you see us on podcasts or in the media, please reach out and see if you can get involved either in contributing or partnering, or if you need care, please reach out to us to help with that. I guess all of this for me comes down to a belief that care and treatment works, and that people that have access to treatment are going to ultimately be better people, better parents, better spouses, better partners. And so if we can open those doors so that people can get access to that care, we are confident when people walk through them, there will be substantial individual, community, and societal benefit. So we invite people to walk through those doors. Treatment does work. There is a lot of hope within the treatment community. The primary barrier has always been the ability to pay for care when people need it, and we think we found the solution to solve that.
InherisAI, InherisAI. So for our listeners, Inheris, InherisAI. Remember that name. More to come. Alyssa, Miles, and Ron, I can't thank you enough for joining us here on Health Futures. And I love the fact that you're reimagining how philanthropy can lift up those that are being challenged every single day with behavioral health. So keep an eye on InherisAI. Thank you, guys. Make it a great day. We'll be back next week.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com.